So Gina asks, how does one test for small intestinal bacterial overgrowth? Great question, Gina. So there's 3 ways we can test this. Number 1 is that if I clinically think that you have this, I'll just treat you for it. So you don't necessarily have to be treated or tested for this condition. If I think that you have it based on your symptoms, based on your risk factors, I can certainly just treat you empirically. Number 2 is that sometimes we can do what's called a breath test, where we actually have you breathe into a machine, and based on the result of that test, we can determine if you actually have this condition or not, and if you do, we can treat you. And then lastly, the gold standard, the number one way to test for this is to actually get fluid sample from your small intestine, and we actually do this ourselves. We're actually able to get fluid sample from your small intestine, look at this under the microscope, and check the predominance of bad bacteria to good bacteria. And if we see a predominance of bad guys, we will diagnose this in the right clinical setting, and then we can put you on some treatment to get that taken care of for you. Great question.